So psychology does play, I think, a really unique role in the human rights field by virtue of the fact that we can sort of take stock and take account of the human cost of human rights abuses. Mm-hmm. So what psychologists do is we are in the business of understanding human behavior, understanding reactions that humans have to, circumstances large and small. And so when you are looking at a context in which people are being hurt, psychologists, I think, have a particular strength in their skills, which is that they can take account of what's happening, they can evaluate people who've suffered human rights abuses, they can tell their story, and more specifically, they can really document the effects of interpersonal human violence on the human organism. One of the things we do at the Bellevue program is we document, well, what happens to people, when they're held in prisons and harmed, when they're subject to conditions of confinement that are incredibly frightening and unhygienic, and when they're subject to threats to their bodily safety, to their loved ones, when they're hurt physically with beatings. And we can document those techniques as well as the aftermath, the consequences on the well-being of the individual. So one of the things we'll do is document, what kind of physical complaints do people have who've been tortured? What kind of psychological issues do they struggle with? So I guess for me, the role of psychology in the human rights world is critical, which is the documentation of the toll of human rights abuses and violence. And just as I think part of that is that once you document it, you're also then able to share it with the world, make change, try to prevent these kinds of things from happening again by bringing them into the light. You could create, I think, a context of healing for survivors by telling their story. So it's another role that psychologists have that I think those of us who do this work are quite proud of, which is being able to help people survive and heal. And then finally, I think that the role of psychology that's very essential in the human rights world is to tell the stories of survivors so that those who experience this kind of violence in the future can look back and see that recovery is possible and there is hope. And I think that's another really important part of the work that we do to document abuse. Yeah, I think the APA right now is engaged in a very robust discussion about, what took place after, about 2002 onward in terms of the role of psychology in some of the things that were done in these detention centers that the United States was running. And so the discussion, I'm saying it's robust because there's been more information brought to light with something that was with a report often referred to as the Hoffman Report, which really showed that APA had in fact facilitated the role of psychologists in some of these abusive settings. And so one of the things that's been a good outcome is that the APA has now prohibited psychologists from participating in intelligence gathering or military-based interrogations. And, I think many people in the field feel that was a good step, though a bit late. I think the discussion continues as to what's the role going forward in terms of also the psychologists and other mental health workers or health workers who participated in this. Should they be accountable? What should happen to them, criminally, civilly? How about licensure? Should a psychologist who possibly enacted abuse on a detainee have a consequence in terms of his or her license? So there's still a lot of discussion and dialogue, I think, in the psychology field about it. But certainly, there's been some progress in that the psychologist being a part of interrogations that are extrajudicial has been stopped. I think that for those of us working in the field of torture treatment, this idea of bearing witness is really critical because the survivor of torture has experienced this thing, torture, that is designed to sort of annihilate his or her sense of self. It's designed to objectify him, to turn her into an object, to make them feel really, really less than. You're not a person. That's what torture tries to do. And that's what the torturer tries to do. And so the idea that the field of mental health and medical caregivers who work to heal torture survivors, the idea that you can bear witness is sort of a way to say, your story does matter. You're not an object. You're a subject in this story. Your subjectivity and what you share will be heard. It'll be listened to. We'll reflect it back to you, and we'll share it with the world as much as you want. It's a way, in some ways, I think, to take back the person's subjectivity and to try to undo turning them into an object, which is what, of course, torture does by dehumanizing. So to me, bearing witness is sort of, the core of everything we do at the Bellevue Clinic and in other places that care for survivors. It's saying your story matters, and it would be a privilege for me to hear it so that we can give you back your state of power and control. Working at the Bellevue NYU program is a tremendous privilege, working with survivors. I have to say the work is painful sometimes in terms of hearing about human cruelty and seeing the cost to people. I mean, seeing somebody suffer after they've been hurt. But honestly, the work is incredibly inspiring and very, it's very exciting to see people rebuild and to see them take control of their lives again. So while the pain of it is real, what you also experience, I think, is that power of the human capacity to heal. And in my mind, I've never seen cruelty that sort of wasn't able to be countered with compassion. I mean, I'm not saying erased, I'm not saying taken away, it doesn't make it all disappear, but I've never seen the human capacity for compassion not be able to move in a way that, that made a dent in what human cruelty, can do. So to me, the challenges are, it's hard and it's painful, but it's completely worth it when you see how strong our patients are. So at the Bellevue program, we do a kind of combination of things. We're a multidisciplinary clinic, and we do treatment and evaluation of survivors. So that's that sort of, one-to-one evaluation, history taking, providing a treatment care plan, and then providing individual group therapy. We do research, which is we look at what we've learned. What are we seeing as the consequences of torture around the world? What are we seeing works to heal? And so we use that research opportunity to then disseminate so that people can do more effective treatment. We also engage with NGOs around the world, training them. We train lawyers, we train government workers, we train students, we train health professionals about the reality of torture, what it is, and how it can be, what the consequences of torture are, but also how it can be treated. So we do a lot of dissemination of also best practices. And then we do advocacy work to try to stop torture. I mean, we work on issues, human rights trials, where there might be, prosecution of somebody who's enacted tremendous violations. We work to have accountability to those who torture, whether it's, addressing the licensure issues of psychologists who participate in torture and seeing if there's accountability that can happen there, or trying to prevent further enactment of torture by U.S. mental health professionals by working with the APA. So we really try to be, multidisciplinary about recognizing that torture is a massive public health problem. So you have to attack it on all kinds of fronts, both micro and macro.